Hi, my name is Matt. I'm from Seattle. I'm a member of the ThyCa Seattle support group and a coming up on 10-year cancer or papillary thyroid cancer survivor. And we are here for the session number 134, adjusting to and coping with thyroid cancer. What does this mean and look like for me? With Kimberly M. Davis, PhD, clinical psychologist. Kimberly Davis, PhD, is a research associate professor in the departments of psychiatry and oncology and the director of psychosocial oncology in the Lombardi Comprehensive Cancer Center at the MedStar Georgetown University Medical Center in Washington, D.C. Dr. Davis received her doctoral degree in clinical health psychology from Washington University in St. Louis, Missouri. She completed her residency at Rush St. Luke's Presbyterian Medical Center in Chicago, Illinois. At the Lombardi Comprehensive Cancer Center, Dr. Davis provides psychosocial services for patients, families, and survivors throughout the continuum of cancer care. And just a note, we will be taking questions through the session, and there will be an open Q&A at the end as well. And I present to you Kimberly Davis.
So my name is Dr. Kim Davis, and I'm at the Lombardi Comprehensive Cancer Center at Georgetown University in Washington, D.C. And I'm a clinical health psychologist specializing in psychosocial oncology, which is basically the title of my talk, which is adjusting to and coping with cancer. And specifically, we're going to be talking about, obviously, thyroid cancer today, looking at understanding what does it mean and look like for me. All right. So common reactions to having a cancer diagnosis. These are just some of the different emotions and reactions that people oftentimes have with a cancer diagnosis. People have a feelings of shock or disbelief, fear, sadness, loneliness, anger and guilt, blame, distress, and control or perceived control, as I like to kind of clarify. So let's go through each of these. Shock and disbelief, what are they? Shock and disbelief is this sense of almost like numbness that people tend to experience. It includes sort of a temporary inability to feel or access emotions. And it's an inability to process the reality of what you are being told when you are being told you have a cancer diagnosis. Fear, lots of fears or worries and concerns ranging from how is this diagnosis going to affect my life? What is it going to do to me in the immediate and then the more long term? What kind of side effects might I have? How is it going to impact my life in all the different ways? Will it impact my ability to, live as long a life as I thought I was going to live? All of those kinds of questions and fears and worries and concerns, many of which are rational, some are irrational, but fear nonetheless drives a lot of questions and a lot of questions about what and how you'll be able to manage this new experience. Sadness. Sadness is a strong negative emotion, as we know, oftentimes manifesting through tears. People also feeling down or blue. This is oftentimes based on what people have experienced through the experiences of other people. Okay. Then distress. Distress is a complicated term for a lot of us to really understand, but to explain it, it is a multifactorial, unpleasant experience, including psychological, which psychological encompasses cognitive. So those are your thoughts, behavioral and emotional aspects, as well as social and maybe spiritual for some people. And we know that distress can be and is associated with negative impact on people's quality of life. When we think of quality of life, we think of things like your emotional well-being, your functional well-being, how well you're able to do the things you want to do. It also impacts your physical well-being, your, how you're feeling. And that really is a lot of different aspects of the person you are. And distress can be very debilitating and cause a lot of disruption, which is why people get so disturbed when they get a cancer diagnosis. Other emotions and reactions that people tend to have with a diagnosis of cancer: anger, guilt, and blame. Again, strong negative emotions oftentimes associated with a cancer diagnosis. Oftentimes, coming from experiences that you have via other people and their experiences. You take what you've seen, other family members or friends. You take what you've seen in movies or in shows. How cancer has been portrayed has a big impact on people's ability to understand what it means to have a cancer diagnosis. People can get very upset and mad at a cancer diagnosis. Oftentimes there is a sense of vulnerability that people experience. People really struggle with trying to make sense of why this happened to them, how this happened to them. The question of why me, why now, why this kind of cancer. Another reaction can be a great sense of loneliness that can come with a cancer diagnosis. There's a great sense of isolation that some people experience. Oftentimes this feeling of loneliness and or isolation is often due to really feeling a lack of understanding. You feel like people don't understand you and they don't understand what you're going through. And oftentimes people will say that, with everything that they're going through, it's too much effort to have to explain all that this experience is. It leads to people feeling a sense of distance from other people. This distance can be a physical distance. It can also be an emotional distance. And then loss of control. Loss of control is oftentimes actual controls that you're feeling and you have loss of. You can also have a feeling of helplessness, that you don't know what you're supposed to do. You're now not feeling in charge of your life. Rather, you're feeling like your life is being directed by other people. It's being directed by doctors who you feel, you have to give the control over to them to help you, hopefully, to get better. There's a sense of powerlessness that can come with a cancer diagnosis. And this helplessness and powerlessness oftentimes leads people to feeling extremely overwhelmed. And that feels disorganizing and disrupting and very unsettling for many people. So here I've listed a number of what have been described as and characterized as curable types of cancer, of which thyroid cancer is oftentimes described in the list of curable types of cancer, right? Other types of cancers in this category include prostate cancer, testicular cancer, melanomas, and some early stage kind of breast cancers, right? So what I say to people is when dealing with, a diagnosis, oftentimes people want to know, well, what kind of cancer do you have? And you tell them, I've got thyroid cancer. And suddenly there is a shift in the conversation, because what happens when people start talking about a cancer diagnosis is they go to what they know, they go to what they have heard and or what they've seen experienced by other people. So different experiences come out and people immediately think, oh, thyroid cancer, that's a curable cancer. Curable oftentimes leads to this sense of it's an easier cancer to then cope with, right? People say things, for example, like, oh, thyroid cancer is not as bad because it's not as serious a cancer. People say things like, it's not a big deal. It's a more manageable type of cancer. In portraying it or categorizing it in this way, oftentimes people with thyroid cancer really experience a sense of diminished feeling as a result of that, because they feel like, oh, their cancer is not as serious as other types of cancer. And this can cause a lot of distress because they're thinking, well, it's negatively impacting my life quite a bit. And it's hard to hear people minimizing it, knowing all that you're going through. So what do you go through? Thinking about thyroid cancer, these are the kind of most common types of treatments that people experience. Surgery being very, very common, right? Then there's radioactive iodine treatment, external beam radiotherapy, targeted therapies, and chemotherapies. On the whole, you look at these, and many of these have a lot of overlap with other types of cancers. People have surgery for lots of different kinds of cancers. They have radiation, they have chemotherapy, they have targeted therapy, now immunotherapy. So there doesn't seem to be a lot of difference. So how do you make sense of, differentiating the different kinds of cancers in one's head? Oftentimes, though, people make assessments, right? And if people say, oh, well, what kind of treatment did you have? And they say you had surgery. People think, oh, well, that's not so bad. You just had surgery, right? The word just inserted in the middle of that sentence, again, it sends a message of dismissiveness to the person. You just had thyroid cancer, you just have thyroid cancer. It makes people feel like it's not that serious. And the truth of the matter is that anytime people get a diagnosis.
Looks like we've lost Dr. Davis.
Yeah, she froze. Let's hope it comes back.
See if I can you see the slide now?
Not yet.
Not yet. Okay. Okay. Can you see the slide now?
Yep, there we go.
Okay, sorry about that. Let's see. Trying to get back to my slide here. Got it. Okay, so a fear of recurrence if the thyroid is successfully removed. There's also a fear of what will happen if the cancer may return in another part of your body. Then you have all of the follow-up care. As part of the follow-up care, a lot of people feel once you've had treatment, particularly for thyroid cancer, there's a question of survivorship. Survivorship is a very, tense word, if you will. It is a word that I don't use unless I know that somebody wants that as a label to be associated with them, because when you say survivor, what does that actually mean? What does it mean to be a survivor? I pose that to you all here listening to this talk, because it means a lot of different things to a lot of different people. How do you become a survivor? And how do you remain a survivor? Big questions that have lots of different answers. There's none that's right or wrong, but it's something that people struggle with quite a bit. I see that there's a question in the chat. I'm just going to stop here for a second and just answer this question, if I may. My medical oncologist recently took a position at Georgetown. Have you met her? Oh, all right. I do know of her. I have not met her, but I do know of her. Thank you. All right. So talking about survivorship, it's a big word that means a lot to different people, and it can be really helpful, but it can also be very confusing for people to figure out, to understand, to try to determine where they fit along the continuum of, of being a cancer, having had a cancer, and then at what point do you, stop being a cancer patient, if you will, and start being a survivor. Can those be simultaneous? Can you be a cancer patient and a survivor? My belief is that yes, you absolutely can. But different people have different opinions about these different things. Along with the cancer survivorship, or the idea of being a cancer survivor. Let's see. Okay. Comes this notion of cancer survivor guilt. Okay. Survivor guilt. What is that? Some of you probably heard this term before. Definitionally, it is a persistent mental and emotional stress that can be experienced by someone who has survived something when others have not. Okay. Oftentimes in the cancer world, thyroid cancer patients or people who've gone through thyroid cancer oftentimes experience a much higher level of survivor guilt than other people, because there is this comparison that goes on. It's a comparison of, you had thyroid cancer. Your cancer is a different cancer because it's a cancer that most people survive. And you have not gone through the same things that many other people have gone through. What happens is that it causes people oftentimes to really overanalyze. They overanalyze their actions. They overanalyze all that they have been through, going through their cancer journey and their cancer experience. It can lead to, strong mood swings and feeling angry or worried or helpless and feeling isolated. Oftentimes people with survivor guilt will pull away from other people because they have this sense of, I survived, but other people didn't. And why is it that I would have the chance to survive, but another person would not? That can cause a lot of distress for patients. And I see it a lot with thyroid cancer patients, again, because there is this comparison that sometimes people make where they're trying to, say that the cancer is just not as serious, but it really causes people to feel judged and misunderstood, if you will. Okay, so treatment side effects. In the context of thyroid cancer, common treatment side effects. Sometimes people experience side effects within weeks or months of finishing and completing their treatments, right? Some don't have, don't experience side effects for, years until years after their treatments. But common side effects can include the following: neck tenderness, swollen glands, loss of taste or taste changes, food changes, right? Dry mouth, dry eyes, an excess of tearing, weak or hoarse voice, difficulty swallowing. At first blush of seeing something like this, you see these symptoms and you think, well, these are not that bad, right? How bad is it if you have these things compared to, what some people feel in terms of like nausea and fatigue and tiredness and, pain. But again, there's that comparison. People are doing a comparison. If you haven't had persistent dry mouth or dry eyes, you don't really know what that means. You don't know what that feels like. And again, I think there is a dismissal that oftentimes people who have thyroid cancer kind of experience. It can be really hard for people to try to make sense of and try to explain. That's another piece that goes along with being, in the world of cancer, having a cancer diagnosis. There is a lot of work that goes along with being someone who has to deal with cancer. There's a lot of explaining, helping people understand what it is that you're going through, what the treatment is, what the follow-up means. And there's a huge burden, if you will, that's placed on you as a patient or, your family member as a patient. And that burden can really, really be very draining, very hard to manage for people. I'm going to just pause here and just I see that there are a couple of questions in the chat. Thank you for contextualizing survivorship. I prefer to talk about living with the consequences of cancer and cancer therapies. Absolutely. Yes. And as I said, before, I do not use the word survivor unless I know that that is something that somebody wants to be referred to as. And I specifically do that because I've had a lot of conversations with people about their thoughts about that and what it means to them or what it means to not be considered a survivor. So love to hear other thoughts about what people have either experienced or how they interpret or experience that word. All right. I'm going to read one more question here. Would excess tearing of thyroid cancer only be a sign of treatment side effects, or could it be the result of having thyroid cancer? I am going to defer that question. I am not a medical oncologist or an endocrinologist, so I can't actually answer that question specifically, but I'm sure that we can get somebody to weigh in if we have any physicians on the call. If someone would, put that in the chat, that would be great. If not, we'll definitely get that answered for you. Okay. All right. One more question has just popped up into the chat. This is great. Getting some dialogue here. I cannot control what other people will say about thyroid cancer patients. For example, some people said, oh, that is nothing. If you have cancer, this is the one you will want. These comments are these comments are frustrating that add up to my stress. Can you recommend how you would respond so that these comments will not be so stressing? Yes, this is an excellent point. Thank you so much for that comment. And this is what I call one of the burdens of particularly of thyroid cancer, because people do say these and many other kinds of comments. I'm sure many of you could, add to this list of comments that people make. Oftentimes people share their thoughts or experiences and they say things in an attempt to try to make people feel better. Unfortunately, it is oftentimes the case that they don't actually make people feel better. And sometimes they can make people feel really worse. They can make people feel upset. They can make people feel stressed. I would say that, helping people understand, but again, the burden with this is that you feel a sense of responsibility to sort of help people understand that, every kind of cancer is really different. And it is, you can't make people know things, but you can clarify for them that, everybody has their own experiences and you're just going through doing the best that you can. Sometimes trying to explain to people can be more burdensome and stressful than not. You might have to just let them believe what they want to believe. And, if they want to believe that it's an easier cancer, then that's their experience. We can't tell people what their experiences are. But a very, very good question and a very important one that, again, particularly in the thyroid cancer world, I would say this is one of the burdens that comes with, and it may not upfront, it may seem like thyroid cancer is an easier cancer, if you will, but the stress that comes with the perception that it is an easier cancer is a heavy burden for people to carry. All right. I've got another question here that I want to get to. I have a rare anaplastic thyroid cancer, which is extremely deadly. How do I deal with the people who dismiss thyroid cancer as the easy one when I'm experiencing this lethal diagnosis? First, let me just say, I am sorry that you have to deal with this, but this is, again, the burden of the thyroid cancer diagnosis, because people assume that all thyroid cancers are the same. Thyroid cancers range, and that is why I said is oftentimes a curable cancer, because not all thyroid cancers are curable, unfortunately. And so, again, you could spend a lot of time and a lot of effort and energy trying to help people understand this. What you can say is, unfortunately, I have a type of thyroid cancer that is not a curable type of cancer and can be quite, deadly, and help them understand that. Again, that's if you choose to take on that burden. It can be a lot to take that on. So I put that out to you to think about if you want to take that on. It may go from day to day that you want to do that, but it is a hard thing. And it's also really hard for you to be in a group of thyroid cancers that is not the easier, quote unquote, one, or the one that rather is curable one, because that is also very hard. And you may find yourself thinking or wondering, why this kind of thyroid cancer? Why couldn't I get a more curable type of thyroid cancer? I would strongly encourage, if you haven't already, to possibly try to seek out somebody to talk through and work through some of those questions if you find yourself having those kinds of questions, because that's got to be very difficult. And to just work through all of that in your head can be super, super challenging. All right. Let's see. I'm just trying to keep mindful of the time. All right, I'm going to take one or two more questions that are here in this chat. Let's see. My own mother once said, technically, you did have cancer, and I found my important people were really threatened that I had to adjust my role in their world. They understood me in one way, and I couldn't be that way anymore. Interesting. Yes, this is this burden. You all are going to get tired of me saying that, but it's the burden, I would say, of having thyroid cancer, because there is this huge belief that it is not as serious, and it is hard to manage the perceptions that go along with thyroid cancer, because they can be so dismissive, and it does not allow you, quite honestly, it doesn't allow you to process this experience, because at the end of the day, you have cancer, and that is very real, and that can't be taken away, even when it may be misunderstood or it might be misperceived by other people. I hope that might address those feelings that you have. Can we have a live dialogue instead of typing questions? I have several things to say. I don't believe we have that capability right now. If the producer can confirm that, I think the way that this is set up is it's a webinar. If there are a couple of questions that you might want to ask in particular, if not, I'm happy to have a discussion with you at a later point in time. So please feel free to reach out. I think that you can get the contact information from the organizers of the conference. Okay. All right. Let's see. I think we have gone through the questions that are currently that were in the chat. I'm going to continue. Let's see. All right. So adjustment, right? So oftentimes there is an adjustment period. There's an adjustment period just getting a diagnosis of thyroid cancer. And then it's the returning to life. And I say returning to in air quotes, right? Because oftentimes people will say, I can't wait to return to my life. And my experience, I've been in the area of oncology for over 18 years here at Georgetown, and then in prior training before that. And I would say that most people will say, when you get diagnosed with cancer, there is an attempt that you will return back to life for some people. Oftentimes, though, people will say you don't return, because you can't return to something that you can't get back to. Once you had a diagnosis, you've always had it. What I encourage people to try to think about with cancer diagnosis is the following. I try to help them say, okay, what I want you to do is understand cancer is one part of my life. You have like the circle, which is your life, and cancer is one wedge of that circle. And you try very hard to keep it at a manageable space and a manageable amount of the larger totality of your life. But there are times when it can feel like it's taking over the whole of your life. And then you have to pull back and say, okay, what can I do? But oftentimes it just becomes another part or experience of your life. So the concept of returning is oftentimes a challenging concept for people to kind of deal with. But when you think of returning, you think, okay, I want to be able to do the things that I used to do. I want to be able to do the activities that I want to do. Well, in order to do that, you usually go through an experience of adjusting the norms of your life when you have a cancer diagnosis. And this goes for particularly for the thyroid cancer patient population who, you go through a treatment period and you have the immediate effects, and then you're getting back to doing the things that you were doing, but that is creating a new normal. You have a new norm for what your life is like, having gone through what you've gone through. And oftentimes for, again, this group, you have this feeling of survival guilt, survivor guilt that can accompany, doesn't always, but can accompany a thyroid cancer diagnosis. So what is the impact of your cancer? These are some symptoms that people can experience. So some people will report increased anxiety, right? Fears, concerns, worries, depression, low mood, feeling down, low, blue, sad for extended periods of time, not being able to function at your normal level of productivity. Sometimes you can have anxiety and depression kinds of symptoms. You can have a full-on depression or anxious diagnosis, or you may just have features of those things, but that can be very negatively impacting. Also, I would say sleep disturbance. Sleep is a huge part of life that is negatively impacted by cancer, and can be disturbed greatly. And if you have ever had sleep disturbance, you know that it does not take a long time for your functional abilities to be significantly impaired when you have persistent sleep disturbance. Okay. All right. So I pose to you all that are here today talking and listening, what impact has cancer had on you? How is your life different as a result? Whether you've recently been diagnosed, whether you've been dealing with this for a little while, or whether you were diagnosed, several years ago, it still has had some kind of an impact. And it's important to think about and give yourself the space to think about what kind of an impact it's actually had. Do you have fears of recurrence or other types of fears about your experience with cancer? And then question is, how do you cope? I think this is a question, and these are questions that don't oftentimes get posed, especially in the world of thyroid cancer, because of the minimization that happens with this type of cancer. But there's a lot of coping that needs to happen, a lot of making sense of, how did you get cancer? Why did you get cancer? Why did it happen when it happened? How do you make sense of having cancer in your life? And what are you doing with it now after you've been treated maybe for some time? Or maybe you have ongoing treatments that you're going to have to deal with and you continue to deal with. Again, how do you cope? Okay. I see a new question that's posed up in the chat. So let's see. Yes, this is a great question. Okay. How can you cope with anger because of a medical community that has led you astray, lied to you? Combine that fact with 3 other major medical issues that have been happening simultaneously with the cancer, and the fact that family and friends avoid talking to you. Okay. Abandon you so that you lose that support that you always counted on. The isolation from those perceived as close, and the fact that your doctors have lied to you. I have a lot of issues of anxiety and anger. I did what my doctors told me, and what did I get? I still have cancer. I have the quote unquote easy one, papillary. I do not sleep quite a lot. I have nothing to look forward to because I'm constantly trying to go to doctors and get tests for all things. It's a full-time job, and I have a full-time job. Absolutely. Thank you so much for your thoughts and your comments. First of all, this is a perfect example of what I'm talking about, right? You are dealing with so many different emotions, strong emotions. I think my biggest suggestion about coping would be, I strongly encourage, if you have the access, and I encourage you to seek it out, is to find somebody who can understand what you have been going through. Someone who has experience with working with cancer patients, preferably also who has had some experience working with thyroid cancer patients, if at all possible. The experiences that you're talking about are really real and are very, very distressing and debilitating for people, because you can have, what is considered to be a curable cancer and find yourself yet not in the curable space, right? And so it is important for you to, if you don't have the support right there in your family and friends, and I'm sorry that you don't have that with them, but it's important for you to be able to find that support and get that support somewhere. Because if you're going to be dealing with this, particularly for any extended period of time, you're going to need that support. The support is what is going to help you to manage those really, really strong emotions, those feelings of anger, the anxiety. The anxiety can be, really gripping, and it can get hold of you and really, you can have a hard time letting that anxiety go or learning how to manage that. And it is important for you to be able to have a place and a space to be able to manage that. I will say that I think that it's important to have people to talk to, in particular, a therapist or or a counselor of some kind. It is, in my esteem, it is important to find somebody, particularly with cancer experience, because you can seek out a therapist in the general community. And if you don't have somebody who's had experiences with people who have had cancer, it can go sideways pretty quickly. And what I mean by that is that I have had a number of people who have seen people in the community and they've just not had any experience with cancer. And as a result, it has not helped them to manage or cope, because there are certain things, the uncertainty that comes with cancer is a different kind of process thing that needs to be processed than other people who are dealing with other aspects of life that cause anxiety. People really feel it, and they get the feeling that their therapist, who is supposed to be helping them, really just doesn't have a clue and doesn't understand how to help them manage the uncertainties that you experience with going through a cancer diagnosis. So I would strongly encourage that if you can. Another aspect, and I'll just flip to my next slide as I'm saying this, because this is part of my suggestion, is really to possibly also seek out support groups. Support groups can be really, really helpful. Oftentimes, support groups can vary in their formations. And what I mean by that is you can have support groups that are very heterogeneous. You can also have support groups that are much more homogeneous. I would definitely encourage, for those with thyroid cancer diagnoses, if you can find a thyroid cancer group, that is probably a better a group to serve you. And what I mean by that is because in a more heterogeneous group, you are much more likely to get even people with cancer who are going to minimize what you're going through compared to what they're going through. And that can be really, really devastating. And so my preference, and what I encourage people to do, is to try to seek out. Since the pandemic, there are a number of organizations that have gone to, obviously, a virtual model for support groups. And I encourage you to seek out opportunities for online groups that you can have that are able to share with you and link you up with other people with either your particular type of cancer or something like it, if at all possible. Other resources, other ways of managing or coping, if you will. Sometimes if you are experiencing tremendous levels of anxiety or depression or other issues related to emotional or mental health and well-being, you may need to seek out medication to help you manage and cope with those particular emotions. And I would encourage you to talk to somebody, to see if that is something. Cancer, unfortunately, as we know, does not discriminate. So you could be living your life going through having your own existing challenges before all of this happens. You could have a pre-existing anxiety or depression that all of a sudden now is exacerbated because of this new condition in your life called cancer. That is really important to be able to understand that there is a lot of synergy that happens when you have medical conditions and multiple conditions acting together. Okay. Other forms of coping, it may include meditation. Meditation has been shown to be very, very helpful. I encourage people to seek out mindfulness classes and meditation, also learning relaxation techniques. Relaxation techniques can be very, very helpful. There's something that is accessible, something that you don't have to go to someplace to get. It's something that you can do on a daily basis. You can do it multiple times a day if you so choose. It also gives you a way to address the perceived lack of control that you have in your life. There's so much with dealing with a cancer diagnosis that you cannot actually control, or that you don't perceive that you have the control over. So the ability to calm yourself down when you become worked up, whether it's about the cancer or it's about other parts of your life, right? Is really, really important. And people who learn the skills, they learn techniques to be able to manage and be able to cope better, are able to function better and manage having a cancer diagnosis in their world. Also, really encourage people to seek out other aspects of care, such as diet and nutrition, and exercise for that matter. Somewhere it popped off my screen, but I had exercise as the last bullet here. All of those things are important aspects of life, and they're things that you have the ability to manage. You can seek out help for learning how to eat a little bit better, or learning how to eat differently, learning how to exercise properly and in healthy ways that can, improve and help you manage your life. So let me see, I'm going to stop here for now. And I'm going to, I think there's another question in the chat. Let's see. Okay, two more responses, and I am mindful of the time. We have about 8 minutes left to go. So please feel free, if you have questions at this time, please feel free to send them in the chat. I will try to get to as many of them as possible. If I don't get to them, I again am happy to answer your questions or comments after the talk, if you want to reach out. My experience has been that there was little or no information provided about longer term impact of hormonal aspects, such as cognitive function, insomnia, mood, and potential long-term impact of surgery, lymphedema, scar tissue. There is a focus on the possibility of impact on voice or calcium, but almost none of the rest. It's presented as if you only have to take a pill and everything will be fine. That has been far from my experience. Yes, I will completely agree with that comment. And I think it is very frustrating. And I think that this is why we need more people to be in the field to help people understand that there is a lot to adjust to, Every treatment has some impact. And I think it is important that those impacts get addressed and get addressed in the appropriate kinds of way. I really encourage people to ask the questions that they have of their providers. Hopefully you have a provider who you feel like you can talk to. If you don't have a provider that you feel comfortable talking to, I encourage you to seek out those questions that you do have in places. This is a wonderful organization that provides a lot of support and a lot of information specific to thyroid cancer. But, you have a doctor, you have a nurse, you have other healthcare providers that hopefully, if you have a nutritionist, for example, a nutritionist can speak to some other aspects of the treatment that can be very, very debilitating with respect to kind of eating, dealing with insomnia and mood. Absolutely seek out a psychologist, hopefully, again, somebody who has some experience working in the cancer realm. There didn't used to be as many of us, but there are a lot more, and we're hoping that the field continues to build, because there is a lot of adjustment and a lot to manage when it comes to all the different aspects of treatment. All right, I'm going to read one more question or comment that's come in the chat. I've had a less long-term effect of having had cancer. Per se, but much more about the impact of hormonal and post-surgical side effects, e.g. scar tissue, strangling feeling. I feel like I had been told about none of these things. Yes, this is this is a very common commentary that I hear from patients, that there really is a minimization or a focus on certain side effects, but not on others that are more common. And so I think it's really important that we help people, feel empowered to be able to ask the questions, to seek out treatments. I think this is where support organizations such as ThyCa and others can be really, really helpful, because if you can get around other people who have had these experiences, they may be your best bet to help deal with and figure out how to manage some of these symptoms that are very, very real and that you're experiencing, and so that you can get somebody to help address those. I hope that is helpful. All right, we have another comment in the chat here as we're about to wind down. I use music instrumental and it helps me to calm down and to relax. Is there a scientific reason behind it, or is it just me? Is there research on the impact of music in healing of cancer in particular? So I will tell you that there is a lot, not a lot of formalized research. However, there are research studies that have shown the power and the impact of things like music. Music has been shown to be very, very soothing, and obviously different types of music. That is why, for example, we have here at Georgetown, we have an arts and humanities program where they actually have people, musicians come and play in the halls and come and play in patient rooms to help them. And so there is research. You can do some Google searches probably to show some studies that have actually shown some benefits. So you're not the only one, and it's definitely something that can be relaxing for some people. So I'm glad you found something that helps for you. All right. I think we're just about at time. Do we have any other questions that anybody has? Thank you for the resources. Oh, thank you so much. It's been really wonderful. I hope that everybody's been able to hear everything.
Oh no, we just lost her. Oh, there you are.
Able to be up there. Oh, can you
So
hear me?
back. You're good. Yep.
Oh, okay. All right. Oh, one more question popped in. Let's see. What are your thoughts on CBD oil for relaxing? Let's see. I can tell you that I have a number of patients that have and currently use CBD oil. I cannot give you any research findings on it, but I will tell you that many patients do use it and use it in a way that they feel is relaxing and helpful for de-stressing. So my way is, if it helps you and there's no contraindication from anybody in your care circle, I say go ahead and do it. But you want to make sure it's okay by your doctor, but I think it's fine to do, and seek out things that are going to be helpful for you. So we're just about at time. So thank you again, and take care.
And with that, I wanted to send a reminder that this session was recorded, and it will be available on the conference platform after the conference is over. There'll be a play button next to the session when you look at the program. And then after a certain amount of time, it'll show up on the ThyCa YouTube channel as well. And I would just want to send a thank you to Dr. Davis for your openness and willingness to answer questions. And thank you very much to everybody for attending. And we'll see you at the next session. Thank you.